we have a few more stabilization exercises, and people will think of this more for your abdomen, but it really helps with low back pain if you're stabilizing your core. So we're going to do plank positions, plank stabilization exercises. So we'll first do the full plank. Go ahead on your stomach and elbows, and we'll have you up on your toes. We have her doing it on the table, but this is going to be easier to do on the floor. Go ahead, you can bring your feet together and up on your toes and come on up in the plank position. For here, I'd like for you to hold, if you can, try to hold for 10 seconds. See how she's in a nice flat plane here. Her head's not too far down, not too far up. It's nice and neutral with the spine. Shoulders are directly above the elbow. That's perfect. Come down and rest. So again, if you can hold that for a count of 10 and try to get in 2 sets of those, that would be perfect. The other plank position will be on your side. We're just going to show one side today. So go ahead, face out that way, face away from me. This is a side stabilizer, and many times if you're having low back pain, we will have the QL or the quadratus lumborum muscle will get really, really tight and tweak the low back. This is one way to strengthen that area once we've adjusted it and have the muscle and the segments associated with that muscle behaving. So let's go ahead. We're going to have this hand right here. We're going to make sure that the elbow is directly underneath the shoulder and that the elbow, the hips, and the knees are all in one plane. The feet come behind and you're in a 90 degree angle here. Bring the legs back just a little bit more. That's perfect. Go ahead, lift yourself up. See how we have this nice open area here? That's what we want. We want you to hold that for a count of 10. And again, we're stabilizing the side muscles here. Obviously, you're going to do this on both sides. Try to go for 2 on both sides, holding for 10. Going down. Perfect. Thank you. And those were the low back stretches and stabilization exercises.